Okay, so guys, it is raining. Farmers are celebrating. It is a season of hope. Because I remember December, I was receiving the calls. Or was it early November? I was receiving the calls. Our animals are starving, we are struggling, we need the rain. But now the rain is here, and the question is, were you prepared, or are you prepared, or did you prepare your animals for this time of the year? Because as much as the rain comes with opportunities, it also presents a couple of challenges, right? And on today's video, I'm going to be highlighting a few of those challenges, and I'm going to focus on a specific disease called HeartWater or HeartWater, as some farmers or some people know it. So if you want to know more about this disease, about what causes it, its symptoms, treatment options, and what you can do to prevent it, please stay tuned and subscribe, like, and comment to my channel. Remember, please. Guys, welcome to my YouTube channel. My name is Dr. Nobs, a veterinarian practicing and living in South Africa. So yeah, welcome to my channel. Please remember to subscribe, remember to like, remember to comment, and remember to share my channel with your world. Don't be stingy with free information, guys. Show fellow farmers. Hey, there's this doctor on YouTube who's dishing out advice. Thank you, guys, and thank you to everybody who's been watching and liking and commenting and supporting my channel. I really appreciate you. Remember, subscribing is absolutely free. So yeah, let's get into today's video. Like I said, with the rain comes opportunity as well as a couple of challenges. All right, so unfortunately, the wet environment becomes a breeding ground or a favorable environment for certain diseases or certain parasites. Both internal and external parasites thrive during this time of the year. For example, I'm talking about worms. You will see a high burden of worms during this time of the year. You will see a high rise in diseases that are caused by ticks. You can also see a high rise in diseases that are caused by flies, as well as certain bacterial diseases that thrive during this time of the year. And you can have food problems. Things like foot rot become an issue during this time of the year. And if you are not ready, or if you don't know what to look out for or how to protect your animals, you might find yourself at a loss. All right, so all of these things, both internal and external parasites, can lead to challenging problems for a farmer. They can lead to losses, they can lead to deaths, they can lead to financial implications, and some farmers may not be ready for any of this. All right, so I'm hoping this video can help somebody out there. So I'm going to be focusing today on a disease that is caused by ticks. All right, and the name of that disease is HeartWater. So what is HeartWater? So HeartWater is an infectious disease that is caused by a bacteria, and it is transmitted by a tick. Okay, the name of the tick specifically on the South African context is called Amblyoma hebrium. I'm going to post the picture. Don't worry about the pronunciation if it is wrong. It is an Amblyoma tick, also known as the South African burnt tick. So that is the tick that can cause you problems. Okay, so this disease is highly infectious. It is non-contagious. It can lead to death if animals are not treated early. Okay, the disease affects both domestic as well as wild ruminants, and for the purpose of this video, I will be focusing on domestic ruminants. I'm talking about your cattle, your sheep, and your goats, and unfortunately your small stock. I used to see this a lot, especially in the rural areas. Your goats and your sheep get affected the most, and farmers experience a lot of losses when it comes to their goats due to this disease. So it's a very important disease. Farmers should know about it, and I hope this video helps someone. Common signs that animals can show when they have this disease are things like high fever, a temperature of more than 40 degrees. That is the first sign. That is a danger sign, right? The next thing is they may not want to eat, they may look depressed, and they might look like they're struggling to breathe, and you may also see foam around the mouth. All right, those are some of the most common symptoms. And as the disease progresses, it can also show neurological symptoms, because the disease does affect the brain, or should I say it does affect the brain as well. So you will see some sort of symptoms to show that the brain has been affected. And these symptoms include things like a high stepping walk, all right? And then you can also see a situation where animals are circling around, and then you can also see a situation where there's excessive blinking and there's this chewing movement, and they'll be very sensitive to touch, looking like when you touch them there's pain, called hyperesthesia. And then another thing is as the disease progresses and gets worse, they can lay on their side with their head pulled backwards, and then they start doing this movement where they are pedaling. All right, so that's usually a sign that, oh, things are not going so well for you and you need to intervene as soon as possible. All right, and then eventually they are going to die if they are not treated. Right, even with treatment, they can still die. But yeah, because the disease has now progressed, right? So now let's talk about the diagnosis. In terms of a diagnosis, clinical signs, the history, and if there's some animals that are dead at your farm, I don't advise farmers to open dead animals. Rather get a qualified animal health technician or a veterinarian to come and help you. They can do a post-mortem, and they can look for specific symptoms that can lead them to thinking that this could possibly be because of heart water. All right, that's when we see water around the heart, around the chest. That's the disease is called heart water. Right, and then other things that they can do is take a brain sample and make a brain smear, and then they can look at that and they can see, if they know what to look out for, they can see signs or confirmation of heart water in that brain smear. All right, and then in terms of treatment, let's talk about treatment now. How is the disease treated? So an antibiotic called tetracycline, especially oxytetracycline, and farmers know it as terramycin. It is the antibiotic of choice for treating heart water. All right. There could be situations where more interventions are needed. Things like anti-inflammatories as well as vitamin supplements can be used, and also provide your animal with a safe area, provide bedding, take them out of the rain, for example, put them in a shaded area where they can be safe and where you can see them and monitor them on a daily basis, and provide them with water and food, please. And then in terms of terramycin, I know a lot of rural farmers have access to terramycin because it is sold over the counter. It's an antibiotic that anybody can buy, but it's important to know how to use it and use it correctly, and use the correct dosage. For example, I myself, once the symptoms of heart water showing on the farm, I prefer to use short-acting terramycin IV, but that is into the blood. But obviously, a farmer cannot have access into the IV. You are going to give the medication intramuscularly, which just means into the muscle. All right, and then please read the packet insert and give the correct dosage that is required over 3 to 4 days. All right, so remember 3 years ago when I started the channel, I made a whole video about terramycin and how much to give and how to use it. Even though it wasn't such a good video, I think it's still relevant. And if you want to know how to use it and how to dose your animal, please go and search on my channel, on my videos from 3 years ago, where I talk about terramycin, and you can learn how to give it and how to use it the right way, or else it will not work. And then another thing, if you are struggling and you think you have heart water at your farm, but you are struggling to control this disease at the farm, you need to call a professional. I don't know if a lot of you know, or maybe you don't know, but there are professionals in your area. It's impossible that they're not there. They are there. They may just be far. All right. But if you start a relationship with them, they know you and they know your animals. When you need them, they will be able to help you. I'm not saying they need to know you to help you. Ideally, we have to help everybody, but it's a good idea to start a relationship with your local state vet office, with your local animal health technicians, because these are the people that are going to help you when there is a need. Okay. And then in terms of control, what should you do to prevent or control the disease? The disease is difficult to control. It's difficult to control because of the type of tick that causes the disease, but there are ways that you can prevent the disease. Regular dipping, you need to be dipping. Look at, for example, this time of the year where it's raining and you know there is a lot of ticks in the environment, there's a lot of worms in the environment, there could be flies everywhere. You need to make sure you are deworming and dipping your animals, okay? You should have done this before, and you need to do it during this season as well. So regular dipping, I would advise something like once a week or once every 7 days for this time of the year. And then also please contact your local animal health technicians to assist you with a further program. And then another thing that you can look at is blocking your animals, which is chemoprophylaxis. For example, I like if there's an outbreak, I go ahead and I start control measures for the rest of the animals. So you need to contact your animal health technicians on how to do this and do it correctly if you are experiencing an outbreak at your farm. Then they can help you with a series of terramycin injections that you need to give, and they can help you as to which days to give what and when to do what. Okay. And then another thing that you need to be doing is when you're getting new animals coming from areas that you do not know, even if it's areas that have HeartWater, because the disease can have different strains, you still need to be practicing some sort of a blocking program, or you must make sure that the animals were vaccinated from where they're coming from before they get to you. There is this thing that happens a lot in the communal areas from the government, which is a good project. They are trying to empower or sort of help small farmers grow or something like that, in a way to alleviate food security and poverty in these areas. They do have projects where they sometimes give a specific farmer goats, or they give them cattle, but sometimes this thing happens without the knowledge of animal health technicians or veterinarians. Then now these animals arrive, we don't know where they're coming from, and the next thing they start dying, and then the farmer now is panicking and looking for help and not knowing where to go. Okay, so you need to make sure when you get new animals coming to your farm and you are in a HeartWater area and they're from a non-HeartWater area, even if they are from a HeartWater area, like I said, the disease can have different strains. Get animal health technicians or the veterinarians to come and help you with a program of what you should do to make sure that your animals do not die from HeartWater. Okay, so I hope this video helps someone. I may not be able to tell you everything, but this is just a guide. Okay, so if you have any questions, please leave questions on the comment section. If you want me to clarify something, please let me know on the comment section and I will gladly do that. Thank you. Please remember to subscribe. Thank you. Bye.